Bismillahirrahmanirrahim. Assalamu alaikum. So this is Dr. Fawad Suleiman. I work as a psychiatrist. So the purpose to make this video is to help medical students and other professional doctors who come across so many patients who have wishes to die, who have passive or active death wishes, right? So we find this variety of patients at accident and emergency. We find them at surgical wards. We find them at medical ward, and even we see them at pediatric ward as well. So, if you come across such a patient, first of all, just confirm that is the patient physically or medically stable. How are vitals, right? How is saturation level and rest of the physical parameters? If all of the things you find are stable, then you can proceed with your risk assessment, right? For that, you have to be very empathic. You have to be, you have a kind of, you have to establish a very good rapport. I mean to say that you have connect well with the patient, right? First of all, introduce yourself. That, for example, if when I am supposed to introduce, I say this is Dr. Fawad Suleiman, one of the psychiatry doctors, right? And then the purpose, why you are here, what kind of professional assistance you can provide to that particular patient. So, first of all, if, for example, if my patient is 20 years old and she has taken 20 tablets, just she had serious intentions to kill herself, right? In such a scenario, how we will proceed, right? So, for example, her stressor was she has recently failed a paper at university. After that, she got disappointed. She took 20 tablets of her roommate. She is staying at hostel, and then she was having serious planning to kill herself, right? To end her life. So, after introducing yourself, you can ask about the event, that how did you land to accident and emergency. I would like to know what has happened. If the patient tells you that I was failed in the paper, something happened bad to me, either I have faced a relationship breakdown or there is some other kind of stressor. For example, in cases of child and adolescents, if someone is ill or if someone is struggling with the life in their family. So there are so many scenarios in which we often struggle, right? So first of all, ask the patient that what was the circumstances, where were you, how did you take that medication, right? From where did you bring that medication? At the time of medication, when you were taking that medication, either there was someone or you were alone, right? Did you know that the medicine can has serious or lethal side effects? You might not regain your conscious level, right? So these questions are very pertinent to ask. And then you can also ask, and furthermore what you will ask, that after ingesting those medications, did you experience any blackout or any flashbacks, right? So how are you feeling physically, and how are you what kind of impact those medications had on your conscious level. So this is all about intention and plans, right? And then you have to ask that how did you land to emergency, who brought you here, who found you there, right? For example, if she says that I was found unconscious on the bed and my roommate has brought me here, then you can ask further details, right? So after intention and planning, you have to ask about what happened after that that incident. So another pertinent question is, you can also ask that how are you feeling, now? You are safe, you are secure, you are medically stable. If the patient says I regret that why I'm alive, I wish to die, so this indicates that the risk of again for committing suicide is very high, right? If in case the patient says like this, that I'm comfortable, I'm thankful that I'm alive, I have my life again, so this means that the risk of recommitting suicide is a bit low, right? And then you have to ask other factors, some risk factors and some protective factors. You can also ask the patient like what are the another important thing before committing suicide is leaving down a suicide note. That is also a serious indicator, right? If someone is planning, so planning always indicate that the risk is very serious, right? They are planning something very serious. So this was all about what you will do, what you will ask prior to the attempt, what you will be asking during the attempt, and what you are supposed to ask at the end of assessment, right? So you have to ask about protective factors and you have to ask about risk factors, right? So in risk factors, we do ask about prior history of depression, prior history of mental disorders in the patient, and prior family history of psychiatric disorders if they have any. And this is also very pertinent to ask about family history of suicide. And rest of the features, like in protective features, some of the protective factors in some histories are social support is a protective factor. In some scenarios, religious support is a protective factor. Some people think about family, some people think about so many other things. So we all are different, we have different dynamics. So I thought that it is very important and pertinent to make this video for our medical professionals, so that we can take an advantage and we can have benefit, and so that we can understand how to proceed to do suicide risk assessment. Thank you all of you for your precious time. See you again. Allah Hafiz.